Maybe announced shortly, for real shortly today. That's
For real,
what we're
for real?
for real. I mean, that's what we're hearing.
What time's the press conference, Chima?
I
Good
don't know
morning.
the time, but I think it has. I think maybe it's going to be the same time.
Oh, yeah, late in the afternoon. Okay.
Yeah. All right. Since it's just us girls here, Chima, you want to go ahead and tell us what kind of restrictions are coming out?
Seriously, I don't know.
I had to try. Chima Mbakwem, Department of Public Health and Social Services. He's the Chief Public Officer, and we're looking for just more info on these cases, Chima. The third day, triple digits. What details can you tell us about the spread and what type of contact tracing clusters you guys are looking at?
So, Chris, I think the increase in numbers coming out from the increase in testing too. We're seeing a lot of community members come out. This week alone, we've almost tested 3,000 people this week. So what we're actually seeing at the test site in Tizan is a continuous increase. I think on Monday we had 675 people come to test. On Tuesday was 790. Wednesday we had a little less, which was 779. But yesterday we actually tested 868 individuals. So we're seeing the community is coming out to test. People are really conscious to know their status. But my message out there is, your test is a point in time test. So when you test, you know what is going on at that point. But if you walk out of that place and you don't follow public health recommendations, there's always a chance, that you can expose yourself to the virus. So knowing your status is an advantage in the sense that you've done your due diligence and then you continue to follow the public health guidance. You wear your mask, wash your hands and keep your distance. Then basically you're going to remain safe. And one more person safe out there is an added advantage to us in the community.
Chima, so at Tizan, though, it's the PCR test, so it takes 24 hours, right, to get the results. We had the former PAG chairperson, Dr. Wynn, on yesterday. GHRA, Mary Rhodes was on earlier this week, and they're all, requesting and feel like it would be faster and quicker if we move to the rapid tests. Is that something that public health is going to do, or we're just going to continue to do PCR testing at the Tizan Carnival grounds? And also, when are we going to open more test sites?
Look, I think the first answer to your question is, is their opinion, and public health actually advertised that we're going to do the PCR up to a certain date, which is Saturday is the last day that we're going to do the PCR. And I think, when people have opinions, most times it spells from, their perception of what is going on. The department noticed that there was increase in the community cases. We were actually conducting rapid tests once a week on Tuesdays. Public health ramped up our testing 6 days a week, moved up our time from 9 a.m. to 8 a.m. Now you're seeing more people being tested. We're getting more cases. That is the intention. So it's not about being rapid or not being rapid. We want to make sure that we are being precise with our test, making sure that we catch the symptomatics and the asymptomatics at the same time. So that was just the strategy that we used to figure out what is going on in the community. So it's not about, just asking us to use one testing platform against another. There are always reasons behind what we do. So first of all is asking public health why we're doing what we're doing, not going out to say what we're doing is wrong. So that is always the challenge. You have, if you have questions to ask, they have my number. They should ask me. You don't run to the press to make those assumptions, because even if you look at the flyers, it's ending tomorrow. So there was a reason behind that. So that's the challenge we have. People are out there saying things, telling us what to do without asking us why we're doing what we're doing. So as of yesterday, we tested 868 people. That is a huge number. And you're also saying it takes 24 hours. It takes 24 hours to give out the test. Anyone who is tested is told to go home and quarantine. That is what you're told to do until you get your result. It is clear. It's black and white. Number two is we have the gene expert. Any individual that indicates that they are symptomatic on their PCR form, they are tested with a gene expert, which actually gives you your result in 45 minutes. So there's a balance to what we're doing. So I think my answer to your question is that tomorrow we're going to, after tomorrow, we're changing our testing strategy because we've been able to achieve what we wanted to achieve within this past few weeks. Actually testing more with the PCR, and I'm finding out more cases in the community. So that is a decision we have to make internally. But we welcome all those suggestions. But I think it shouldn't be on the radio. They have my number. I can answer that question, without us making it a controversy.
I'm gonna get mad.
But
Chima.
okay, so why did public health then start off with the rapid tests at the Teason Carnival grounds and then switch to PCR?
Okay, so do you remember that in the 3 months ago, we were having single-digit cases, right? That was what was going on. We were having single-digit cases. We were testing once a week. There was no community spread. But when we started noticing an increase in those numbers, we had to change our strategy. Because you at this point, with that number of people testing positive, you can't just depend on case investigation alone. There are strategies in public health, to identify. We're doing active case finding. We're asking people to come out if you feel you've been exposed. We did this last year when we had the military case. When we actually asked people, we gave out a list of restaurants. We said, if you've been in this place or you feel you've been exposed, go get tested. We gave people that opportunity to know their status. So when we're seeing such a huge increase in cases in the community, we need to change our strategy. Look at what is going on now. We're still identifying cases through case investigation, but at the same time, we're actually finding cases at the Teason site. We're still seeing cases from the clinics. So we're testing because we feel that there's we see that there's something going on in the community. So we're doing active case finding. So let them go and read up the definition of active case finding in contact tracing, so that there's a clear understanding of what we're doing. So we're just not making up things. There are reasons and facts behind what we're doing. And the numbers are showing it. We're testing 800, 700, 500 people. Basically, before this, we were testing 300, 200.
Yeah. Chima.
So I think credit should be given to who deserves it, and not, trying to make it look like we don't know what we're doing. So that's my position.
You all right, my friend?
Stand by it.
You all right? Let's take a minute here just to bring it down a little bit. Everybody's stressed, Chima.
I don't think I'm stressed. This is me.
I know you're just defending your work. I got it.
I'm just being honest. I just say it the way it is because there's a lot of it keeps going.
Yeah,
on,
but Chima, it's a free country. We can say that we need to improve things. It's okay. We're allowed to do that. It's America.
No, it's okay. Well, that's what I'm saying. But the conversation is not with me. You know what I mean?
Yeah.
They have access to me. We could have a nice, friendly conversation. To get a clarity of what is going on.
Yeah.
Making me come out to act like I'm defending myself. I'm not.
No, wait.
Every action is.
But can you just
exactly.
clarify this? Let's just. So Clara Castro comments in. We tested on Sunday, still waiting for a response. So when people go to get tested, and they're not getting called for 5 days, and we hear this a lot, Chima. That's why we ask about it. What does that mean for these people? Is there just something you can tell people who have not been contacted by public health after being tested?
Let me just paint this scenario. Last night, there is someone who tested 3 days ago that was complaining that they've not been called, right? We actually went back to our documents, found out that this individual gave two numbers. one cell phone and one home number. Both numbers were not working. None. We had to reach out to someone who gave us a number to reach that person. So we still dig deep. We try to reach people. Sometimes you call people, they don't answer if they don't know the phone number. Sometimes the numbers beep because they don't have what they call them again. They don't have airtime. You can't reach them. Then sometimes you call, you reach them, and then you talk to them. So it's a mixture of so many things. But the thing there is that we are also reaching people. So all these other people we don't reach, we still try to dive deeper to make sure that we reach them. Yeah. But these things happen. We get people who don't get those calls, but we keep trying to reach out to them.
So what if this lady left one number and she just was not called? What do you say? Is she negative or is she positive?
You said one number that.
So what if this lady, and Chima only asked because I know somebody who tested positive and they never got a call from public health. So I'm not just making it up.
No, Chrissy, you're not. Seriously, yeah. No, we know because we call and we don't get through too.
Right.
Yeah, we have those situations. Yeah, but the good thing is that for every positive result, it is not even put in the pile of the negatives. We actually give it out to the nurses to make the calls because it's just not about calling the individual. Sometimes you need to give medical advice, and all that goes behind. So we make sure that we do that. But the ones that we miss might be, like what I explained to you, calling at the wrong time, or calling when their phones are busy and then they call back, they can't get to us. But we prioritize the positive cases. It is more of a priority for us than the negative cases, because we want to make sure that we inform those people and then make sure that we cut off transmission in the community and then wait for the case investigators to reach out to them.
Okay, so before we went on with you, Chima, I asked you, hey, did you have any details on contact tracing? And your response was that it is just everywhere, right?
Yeah, we're having we're actually having a lot of cases, in the community, and the numbers are telling you. So we actually, but we're still identifying people from case investigation, but also from the test sites. So it's a mixture of the testing strategy that we're using, and is producing results, because we're seeing people who have not even been contacted, but who felt like they were exposed coming out to test. So it's actually working.
Do you have any update on the testing facility that's supposed to open over at Forever 21? The old Forever 21?
No, it's not a testing site, it's a vaccination site.
Oh, sorry, vaccination site.
Yeah, because we're also seeing an increase in vaccine numbers. A lot of people are coming out to get vaccinated, and then we're seeing a lot of first doses. So people are really coming out. So the mall is more packed. Normally we used to have like 300, between 200-300 at the mall, but now some days we're averaging 500, 700. So there's a huge demand for vaccines in the community.
What about additional testing sites? I know we had Dr. Ann on, Dr. Cabrera. They said that was something that you guys were definitely looking at.
Yes. Because of the mandate for testing for the unvaccinated to go back to work, and the governor said we were going to support that. So we're actually looking at opening up more sites, and that will be maybe sometime next week.
Have you guys seen an increase in people requesting for the replacement vaccination cards?
Okay, so I have the latest data I have here is actually showing that we have people asking for their vaccine cards since 25th, I think since Monday. But we've been able to, on Monday we received 217 vaccine cards. On Tuesday we received 131. And then I think Wednesday was around not as high as those first 2 days. But we're getting emails and phone calls, and we're attending to them. But the like my expectation, about the numbers is not really what it is, because we actually put personnel to handle the vaccine replacement, but it's not, the traffic is not as high as I thought it would be. But maybe it could increase today or tomorrow, but in the thousands on Monday, but it didn't happen.
It only has one bar.
Are you there, Chima?
Yeah, can you hear me now? Yeah, I think I was a little unstable.
Aren't we all?
Yeah, my my internet is unstable, please.
Chima, we're looking at restrictions coming out, well, hopefully today. But what would just be your advice to the community, as we know you're saying that it's just widespread, it's everywhere. So at this point, what can we out here in the community do to decrease the number of positive cases this weekend?
So I think, like you mentioned, if there are going to be restrictions, I think the restrictions will be targeted at those places that we are seeing, a lot of transmission, and the intention of coming up with those mitigation strategies is just to reduce transmission however possible we can, while at the same time we're encouraging people to get vaccinated and wear their mask. But I think the community is actually coming out to test, which is, for me, is a good sign. People really want to know their status, and also people who get tested, actually inform their friends and their family members. So people are coming out to get tested, and we're hopeful that with this positive response we're getting, the community is aware that we all need to come together as a unit to fight the Delta variant, because the reality is that is out there, and is more transmissible. People need to be more on guard, and the other advantage is that the vaccines actually protects you from severe illness and hospitalization. So while we are still seeing people who are vaccinated getting infected, we're seeing that a lot of them are not severely ill, and there's very low hospitalization for people who are vaccinated. And looking at that, we're actually looking at the definition of breakthrough cases, because the vaccines have been said, the vaccines are not a cure, but a protection against hospitalization and severe illnesses. And if you look at our hospitalization, you are seeing people who are vaccinated, getting exposed and getting sick. Getting exposed and getting infected, but you're not seeing them getting sick. Which is basically what the vaccines are supposed to do. And then the unvaccinated are the ones, in the hospital. They are the ones getting really sick. So, and the encouraging thing is that we're seeing a lot of people coming out now to get vaccinated because of the fact that the Delta variant has shown to be more aggressive.
Yeah. So
I think we're doing well as a community, but the results of our increased awareness and adherence to the public health guidance, the results will start coming out very soon. So I think as a community, we're actually coming together to fight this unseen enemy that we only know how to fight with the vaccines and public health recommendations.
Thank you, Chima.
Wait, I wanted to ask,
sorry.
out of the 108 new positive cases, can you tell us how many were vaccinated and unvaccinated?
That was on Thursday. Hold on, please. Just give me a second so that I give you the exact numbers of what I have here.
Hey, this is the link, by the way. Good morning. It's Friday, 7:40. This is Chima Mbakwem. We're waiting on the breakdown. 108 positive cases reported last night. How many vaxxed? How many unvaxxed? Inquiring minds want to know. I got a comment here. Tammy, sore throat is one of the signs. I took my two boys to get tested. Basically, she says she's a stay-at-home mom. She took her two boys to get tested, and 2 out of the 3 had sore throat and ended up being positive. And she says that she's a stay-at-home mom, and that let me get this thread up here.
Okay, so
Thank you.
what I have here is for Monday we actually had 50 unvaccinated, 31 fully vaccinated, 2 that are partially vaccinated. This is for Monday. For Tuesday, we still had 54 unvaccinated, 35 who are fully vaccinated. Then we had 5 that are partially vaccinated and 5 that were ineligible. So this is Monday, Tuesday. So for Wednesday, we have, hold on. Wednesday is yesterday. So okay. They've not reported the preliminary numbers for the 26th. So I will have to wait for that today.
So then that means you don't have from Thursday's
I don't have for
test.
26, yeah. You know, because what actually happens is if they don't indicate on the intake forms, we have to go back to WebIZ, you know, to make sure that we have the correct information. Because sometimes people miss that. So that I don't give a wrong estimate, I just have to wait for them to cross-check the numbers with the WebIZ before I can give the exact numbers. But for Monday and Tuesdays, the numbers I gave you were the exact numbers.
Is there a reason why we don't see that information on the JIC, the Joint Information Center reports?
The way I break it down?
Yeah, the test results, the vax versus unvaxxed. Because people are always ask us, well, what's the breakdown? You know, with the new positives, how come we can't get the information on how many of the positives were vaccinated, how many of the positives were unvaccinated?
Okay, so I'll take note of that. If people are asking for that information, then thank you for letting me know. Then I would work with the surveillance team to add it there. Yeah.
Thank you.
Yeah.
Thanks, Chima. Have a good weekend.
And you too. Thank you so much.
Stay safe.
Right on.
Bye-bye.
See you at the press conference.
Thank you.
Right on.
Thank you, Chima.
7:43. Oh, I'm just going to read this comment here. Tammy is a parent of some public school students, PC Lujan Elementary. She writes, sore throat is one of the signs. I took us to get tested yesterday, Thursday morning. I have 3 boys that turned out positive as of yesterday, and my oldest daughter and I are negative. Mind you, I'm a stay-at-home mom. My kids attend PC Lujan Elementary and Tejan High. And she says, my kids came in contact at school. My 2 sons out of the 3 had sore throat, and my first grader has a common runny nose and watery red eyes. Be very, very careful. Well, prayers to you, Tammy, and to your children, and just all the parents out there. I was talking with one of our coworkers who was just describing the process. So her, it was something like there was a teacher and that was positive at one of the southern schools, and then so they had to quarantine a bunch of the kids, and then a bunch of them had to get tested. So she was describing to me her 8-year-old granddaughter getting swabbed. And remember, to test the kids, they got to stick the Q-tip like way up there, and they were just, I mean, obviously kids getting shots is a big deal. So just in my mind, kids out there getting swabbed, I mean, it's a lot. 7:44, quick break, and